Good morning. It's another 5 or 6 weeks since the last time I spoke to you, and it's time to just give you a catch up on what's going on, and particularly what's happened in the most recent board meeting on Monday. But prior to that, I just want to acknowledge the really terrible tragedy that occurred in Christchurch, and I wrote in our recent Prescribe about this, and particularly the concept of lest we forget, and that they are us. Two quotes, I guess, which are quite relevant, particularly lest we forget around Anzac Day. But what I was really reflecting on was the incredible outpouring of caring and love that occurred post the events in Christchurch, and particularly from the Muslim community, and whether we could learn anything from that ourselves, and particularly whether that is something we could use with our teams, and the concept of getting to know people, and then as you know them you start to care and understand them, and with that understanding I think comes compassion, and so we then end up celebrating and understanding the differences and diversity that we have within our culture and our teams, and that's pretty important when we're wanting to work as well as we can, particularly for our patients, but it also really supports all of you when it comes to issues of well-being, and when you're overworked and stressed, the support from team members, pairing up at times if you're going into something difficult, and supporting each other can be incredibly helpful. And I think we've got some fantastic teams, but we really should all, I think, reflect a little on how we can improve those teams, how we can get to know our team members a little better and celebrate that diversity and those differences which actually make for very effective teams. So just something to reflect on. The other thing that I did also touch on is the concept of they are us, and particularly that sense of the DHB being somewhere else and being something else that at times you can blame, or at times you can criticise, or sometimes at times you can feel good about. But I just wanted to really make the point that the DHB is all of you, and without it we're just a bunch of buildings, and you are by far our most important asset. So getting a sense of us and that we are the DHB is something I'd just like you to reflect on as well. Just going into the board meetings, they were held up in Kaitaia this time, and it was nice to be up there. We've got a great facility, fantastic teams. We heard about some of the innovations going on there. There's an amazing research program looking at through the Maurice Wilkins Foundation and the Moko Foundation, and this collaboration is looking at issues around inequities in Māori health, and one of our staff members, Joel Purney, is very involved in that, as are other people, and we have the research team housed within the Kaitaia Hospital. So fantastic initiative. Many other initiatives that we talked about as well, and very proud of the work that goes on in Kaitaia. So something pretty special up there, as is the case with all of our district hospitals, but noting the isolation with Kaitaia and the good work that they do there. We talked in the meeting, initially in our HAC meeting, about some of the issues that are occurring within our hospitals, and that HAC meeting, which is the Hospital Advisory Committee meeting, goes on for about an hour and a half to 2 hours, and we do look specifically at hospital issues. And some of those that were examined in a little more detail were our acute readmission rates, and the fact that they've been reasonably stable, but they still sit at about 15% or so, which is around average for the country, but still an area which we could improve on, because the less times we need to readmit patients, the more patients I guess we have to admit who've got acute problems, but also it means that our patients stay healthier. Some readmissions are unavoidable, some may be because of complication of care, and particularly infection, and some of those issues are really relevant and often a cause for problems with readmission. We looked at, as usual, at our ED waiting times and the good work that's going on with patient flow, the significant increase in demand into our ED, and the issues of bed block within Whangarei Hospital, and particularly this is focused on Whangarei Hospital. The other district hospitals, smaller hospitals, don't really have problems with ED waiting times and generally have lower occupancies, so don't experience bed block to the same extent. We were looking at the issue of being able to dispense medications on discharge rather than in some cases where we identify patients who may well not pick up their medications from the pharmacy, being able to provide them at the time rather than them have to go to a pharmacy, which then means they don't pick up their medications and then they return even more unwell, or present back to GPs, etc. So something we're trying to work through. There are some rules and we believe we need to get through those rules and make sure that those patients that really need the medication and are unlikely to pick it up can have access to the medication in a simpler way. We talked about the meningococcal W program, and that's moving towards completion now, and it's looking like we will have vaccinated about 15 to 15,500 of our children and youth, so that's under 5s, and 13 to 20-year-olds. And so in those groups there was a population of about 22,000, so 15,000 or so isn't too bad, but really to me it's quite disappointing. I thought we'd get to 85–90% because of the fear of meningococcal W, its immediacy, the fact that 3 people have died in Northland. So I've got to say I am a little disappointed, but no criticism of our staff who've just done an amazing job. It's just a feature of Northland, and in fact a feature of the vaccination issue. There's a lot of anti-science misinformation out there, and I think we're also tripped up by the proximity to Christmas and the challenges there. So fantastic work done by all of our staff, general practice, the community, and I don't think we could have done better, but it does indicate that we have some problems within the community, and certainly around the whole of New Zealand and the world, in fact, with this anti-science social media influence that is now becoming greater and greater, and of course our anti-immunisation lobby is very strong. So it's disappointing in that we may not have herd immunity going into this winter when there's a much greater risk again of meningococcal disease. So that means those who aren't vaccinated will be very vulnerable to this disease, and undoubtedly at that time more families and people will want to have the vaccine, and we may not have it available for free. So that's a shame, but we have run, I think, a really, really solid program, and so congratulations to everyone there. So at the end of March, we talked about our financial situation, and we've got a $5.1 million deficit. We're tracking okay. We believe it'll be very tight towards our permitted deficit of $7.5 million. So that is the target, and that's what we're working really hard to achieve. And obviously that size deficit is quite significant. It puts incredible pressure on our cash and the availability of cash, and so deficits, which are something new to us, come with a real price around availability of cash. That means money to not obviously only spend on your wages, and I promise we will have enough to do that, but also on our facilities improvements, various capital improvements, clinical equipment, etc. So real tight prioritisation of all of that has to go on. We've got a new program underway in primary mental health called Te Tumu Waiora, and that's a program where we're funding health improvement practitioners, psychologists and staff who can provide counselling into two general practices, one KeriMed and the other Bush Road. And that program also includes health coaching from an NGO. And this is to try and improve our primary mental health response, the response to patients who aren't in the 3% who have severe mental illness, which is what we generally focus on, but in the mild to moderate range. And so this is an exciting new initiative, and so we're watching closely and measuring very closely how this impacts on our patients and on their mental health in those practices. We've got the purchase or lease purchase of Manaia House finalised, and so Manaia House is a building down in, from memory, Rathbone Street in the centre of town, and that building has been purchased for our community mental health, and undoubtedly we'll be able to provide some other community services there. So that's pretty exciting, very much a value for money purchase, and we're looking forward to gradually, as tenants vacate, moving our mental health teams into that building so that they can be all co-located, and that's the model of care that allows them to really provide joined up services within the community. And so aligning them also with some of our other community health services will be a great initiative. So a building is just a building, but actually the ability to co-locate and have a facility where it's a good environment to work in, as opposed to scattered all over Whangarei at the moment, prefabs. They're housed in other buildings and also within our hospital itself. So we've got a real opportunity to do something which frees up some space and certainly saves on rental, etc., of multiple buildings around Whangarei. We had a symposium for our Māori health staff, which I believe over 200 attended, and certainly it seemed about 200 when I was asked to open it, and very impressive lineup of speakers, and I think that was a great initiative which supports all our Māori health staff, and there were a number of really useful topics covered during that day which will help them care for their Māori patients and in fact for patients whatever their ethnicity. We've also commenced the construction of the new delivery suite, the new endoscopy suite. We have a new delivery suite, and it's located in the old delivery suite, certainly where I wasn't born, but certainly where I did a lot of deliveries as a general practitioner. So that is being completely gutted and converted into an endoscopy suite. It requires a lot of work, and so that's all part of our critical projects which were funded this year. Making good progress with both the theatre extension, which we need to have those two new theatres as soon as possible, and work is going as quickly as possible to design and hopefully build those as quickly as possible, and also a new cath lab. Those are the main projects in Whangarei, and then there's ongoing work on the Bay of Islands hospital redevelopment, and particularly the primary health care and ambulatory care facility, which will be adjoining our new Bay of Islands ward and accident medical area. So a lot going on, many other smaller projects as well, including looking at and making sure that we're able to air condition the surgical wards. That whole block really needs to at some stage be vacated and our new hospital, but in the meantime conditions are really I think, unsafe and unfair for our staff and also our patients during summer. So commitment to air conditioning and spending a number of millions of dollars, I'm afraid, on that, and recognising that we will need at some stage to vacate all of that facility for a new hospital. So it will be a sunk investment, but it's likely to be a number of years, and so our staff cannot put up with those conditions any longer. So we're very much committed to that, and I'm quite happy to make that commitment publicly. Moving on, we have talked at the board meeting about a number of other issues, and the impact of our RDA strikes and the fact that there's going to be a 5-day strike commencing the 29th of April, which will have a really major impact. And so I want to acknowledge the impact for all of you, our senior medical officers who often are having to cover, but also our nursing and allied health staff and clerical staff, right down to all our booking clerks, and everybody is very involved in this, and it has a major impact across the whole organisation. But it also has a really significant impact on our patients, as you know. So we're doing everything we can to make sure that as few patients as possible attend over that time, and so messaging going out, including videos around keeping the hospital and emergency department for emergencies, and also working with primary health care and our after hours services to make sure that they're doing everything they can to assist as well. So public awareness and working with our primary health care and community is one important aspect, but I do acknowledge the extra work that it puts onto all of you. Okay, we're at the point now where we can finally move on with Whangaroa Health Services Trust, and we were looking at a new model of care and a new provider of primary care services. This was held up by an appeal to the Minister, and that has now been resolved, and the Minister is very comfortable with us continuing and has communicated that to the Trust. So we're working positively with the Trust to ensure this happens in the next little while. This is a relatively small but very high need community of about 3,500 patients, and an awful lot of work has gone into trying to make sure that this community has sustainable health services and high quality services. So that's what we're trying to achieve. Some of the some exciting developments over the next few years planned around some of our high growth areas were discussed, so Mangawhai particularly, and they're looking at building an integrated health centre down there, and eventually Kerikeri. There's a number of options there, but really great opportunities for the future. So with growth comes huge challenges, but it also comes with some opportunities, and I guess we're trying to look on the bright side of all of this growth, but acknowledging the real difficulties that are experienced within our hospitals at the moment because of growth in population. We've got our draft funding package provided to us. I can't give you any detail. That will be confirmed post-budget, but it's needless to say it's going to be tight next year. We have had population growth, but it has been in the youngish population more than the over 65s, and so even though we've got the second highest population growth, it's not in the age groups, either the very young or the very old, that attract the greatest funding. So we are likely to receive a reduction in funding next year of new funding. So we'll still get new growth funding, but it'll be at a lower level, and so that'll present its own challenges, I'm afraid, and we'll have to work together on that to make sure that we can meet an acceptable budget, but guaranteed that that will be still a significant deficit again this coming year. It's not all grim. There's so many fantastic initiatives underway within our hospital, so much innovation, and I really truly also believe we've got a really great culture. This has been reinforced to me by people who come from other hospitals and see the difference there. Everyone knows that it's tough and that there are real challenges for our staff around wellbeing, but some great teams, some real support. And I just want to congratulate you on the overall culture that and quality of care that occurs within our hospitals and within the community, despite all of that incredible pressure that you're under. So thank you all, and we'll catch up next month.